Hi, welcome to Progressive Short Takes. I'm your host, Joe Firestone. In this short take, I want to talk about waiting for a vaccine, waiting for a vaccine to protect us. Dean Baker, a very good economist, who's particularly good on patent questions and vaccine questions, intellectual property questions, has written a piece which you can find at Counterpunch. And I'm going to cover that piece in this short take. So let's get it up there. And the full title of it is Waiting for a Vaccine, Killing for Inequality by Dean Baker. Was published on October 13th. There's a picture of a guy getting a nasal swab, being tested for COVID. And Dean says, I've been harping on the fact that it's very likely China will be mass producing and distributing a vaccine at least a month, quite possibly several months before the United States. This should make people very angry. I know when I read this, it made me very, very angry. Even a month's delay is likely to mean tens of thousands of avoidable deaths and hundreds of thousands of avoidable infections. Yes, if deaths should begin to increase again to 1,000 fatalities per day in the United States, okay, if we get a delay of a month, it would mean 30,000 fatalities, 30,000 more. We've already passed the 225,000 mark, so quite a bit. And Dean says it adds a month to the time period before we can get back to living normal lives. Of course, the delay could end up being many months since we still have no idea how the clinical trials will turn out for the leading U.S. contenders. We are in the situation where we can be waiting several months for a vaccine after one has already been demonstrated to be safe and effective because the Trump administration opted to pursue a route of basically patent monopoly research as opposed to open source collaborative research. If President Trump had gone the latter route, as soon as China or anyone had a vaccine, everyone would have had a vaccine, or at least everyone able to manufacture it. Since people seem to find the alternative to Trump's approach, basically the patent monopoly approach, confusing. Let me outline it simply, says Dean, so that people can see what is at issue. As it turned out, Trump quite explicitly turned the development of a vaccine into a race. He created, quote, Operation Warp Speed, unquote, to which he committed more than $10 billion of public funds. This effort is supposed to develop both vaccines and treatments for the coronavirus. Now, the funding takes a variety of forms. Several companies received some upfront funding, but are relying primarily on advance purchase agreement for an effective vaccine. For example, Pfizer signed a contract that commits the government to buying 100 million doses for $1.5 billion. That's $19.50 a shot if it has a successful vaccine. By contrast, Moderna relied largely on upfront funding, getting $483 million for its preclinical research in phase 1 and phase 2 trials, then another 472 to cover the cost of phase 3 trials, 472 million, of course. Incredibly, after picking up the development costs, the government is allowing Moderna to have a patent monopoly on its vaccine. This means it will effectively be paying Moderna twice. First with a direct funding, then a second time by allowing it to charge monopoly prices on its vaccine. That route was the one Trump chose to pursue. It should be mentioned there was little visible opposition from leading Democrats in Congress. Sure, Pelosi and Schumer love monopolies, don't they? But we could have taken a different approach, says Dean. We could have looked to pool research, not just nationally, but internationally. This would mean that all research fundings would be posted on the web as soon as practical, that any patents would be placed in the public domain so that everyone could take advantage of them. We're actually seeing this sort of cooperation in the early days of the pandemic, which allowed scientists to gain an understanding of the virus more quickly than if we followed the path of the patent monopoly supported research. This path of cooperation could have continued if Operation Warp Speed had been structured differently. Instead of paying for the research costs of a company like Moderna, then telling them they could get a monopoly so that they could charge whatever they want, we could have made the condition of the funding that all its findings would be fully public and patents would be in the public domain. Since some folks have a hard time understanding what incentive Moderna would have if they weren't getting a monopoly, let me explain. They would be getting paid. Just as most of us work for money and not for monopolies on patents, Moderna and other drug companies developing vaccines or treatments would be getting paid directly for their research. Their incentive would be that they presumably want to continue to get paid. If they went 2 or 3 months and had nothing to show, then they would not continue to be paid. This is the idea of working for money. I thought that most economists were familiar with it, says Dean. But when it comes to financing drug research, they seem to view it as an alien concept. Anyway, if we committed $10 billion for open research, presumably we would want comparable commitments adjusted for size and wealth from other countries. For example, Germany, which has an economy that is roughly 1/5 the size of the U.S. economy, would be expected to be paying $2 billion to support open research. China would also be expected to make a commitment that was comparable compared to its GDP, although as a much poorer country on a per-person basis, perhaps the commitment would only be half as large relative to its economy. If we had leadership in the United States that was committed to pursuing a path of open research, then presumably it would be possible to quickly work out a deal that countries are reasonably satisfied with. Doesn't matter that a deal may not make everyone perfectly happy. Lots of things are happening in the pandemic, and the response that are far from perfectly fair. Such is life. Anyhow, in this world of open research, if it turned out that China's vaccines were showing more promise earlier than the ones developed by Pfizer and the Moderna company and other U.S. companies, it would be able to manufacture and mass distribute their vaccines as soon as the FDA approved them. No one would need permission from China since the research was open. Anyone could manufacture the vaccines who had the capability. Just to be clear, using a Chinese vaccine doesn't mean accepting China's safety standards. The FDA would make its own determination of a vaccine's safety and effectiveness based on the data from the clinical trials. If it could not be confident that the data supported approval, then it would not be granted, just as is the case with any domestic vaccine or drug. If we had gone this route, if the Chinese vaccines are shown to be safe and effective before the vaccines but developed by the U.S. companies, we would not be left waiting. If China or any other country had a vaccine, we would as well. This system still leaves a problem for developing countries who lack the manufacturing capabilities, but at least intellectual property concerns would not be preventing people from getting a vaccine or treatment. It's hard to understand how not just the mainstream Democrats, but even progressive leaders like Senators Bernie Sanders, Elizabeth Warren, and Representative Alexandria Ocasio-Cortez were not pushing for an open research response to the pandemic. This almost certainly would have given us a vaccine more quickly. However, an open research approach to the pandemic also could have been a very important model for biomedical research more generally. If we went a route of financing research up front and putting all patents in the public domain, it could save us $400 billion a year on prescription drug spending. This comes to more than $3,000 per household. It's more than twice the size of the Trump tax cut. This is real money. And monopolies on patents also have a lot to do with inequality. We're often told that technology is a big part of the story of upward redistribution over the last 4 decades. While this story is frequently exaggerated insofar as it is true, it is because we have to sign patent and copyright laws so that some people can get very rich at the expense of everyone else. Bill Gates would still be working for a living if the government did not give Microsoft a patent and copyrights on its software. It is more than a bit bizarre that political figures who devote so much effort to combating inequality look the other way when we design a pandemic healthcare research plan that both slows research progress and gives more money to those at the top. It's fine to have taxes that are progressive, but it's even better to structure the market so that we don't have so much inequality in the first place. If the minimum wage had kept pace with productivity since its 1968 peak, it would be at $24 an hour today. That would be a hugely different world. While it would be great if we could raise the minimum wage to $24 an hour, we can't do that without changing many of the rules that allow so much income to be redistributed upward. The current system of patents and copyrights is a really big part of that story. In the case of the pandemic, it is not just leading to inequality, it is also costing people's health and their lives. But progressives should be paying attention. Absolutely, we should be paying attention. We should be reading pieces like this, and we should be doing everything we can to get rid of patent monopolies. That is key to lowering the degree of inequality that we have in our country. That's it for this Progressive Short Take. I'll be back soon with another Progressive Short Take. Thank you very much.